Our next speaker is Dr. Scott Fung and talk about the hepatitis B treatment. So I'll stop sharing. I think Scott should be here. I'll let him see if he can share the slides.
Hi,
Hi,
good afternoon.
hi,
Good
Dr.
afternoon,
Fung.
everybody.
So Dr. Fung is a hepatologist at Toronto General Hospital, and he's an assistant professor and also director of education for the Toronto Centre for Liver Disease. He's a clinical investigator for numerous research trials and had a lot of interest in research on hepatitis B and C. And I'll hand the mic to Dr. Fung. Thank you.
Hi, good afternoon, everybody. Can everybody see my slides on their screen? The
Yes.
little virus picture
Yes.
there. So I think I have
Yep, we
control
can
over
see it well.
the slides. Hopefully, you can all hear me. First of all, I wanted to thank Colina and Hin Hin and all the organizers for inviting me to speak at really this wonderful inaugural session of your patient forum. It's, I think, the first time we've gone national, and so we're very, very excited for things to come in the future as well. So my job here really is to really walk you through the treatments. Some of them are new, some of them are old, for treatment of chronic hepatitis B. And many of you in the room or online may actually be on treatment. And so that's why it's so important for us really, as Hin Hin mentioned, to have the voice of the patient. I think it's really what's missing from a lot of our studies and really from a lot of our clinical trials is to have really the voice of the patient to help us to learn more about chronic hepatitis B. And so I think there is simultaneous translation, correct, Nathan? I don't need to stop every few lines to let the
We have
interpreter catch up.
yes.
Great. So our objectives today are relatively simple. We are really just going to talk about what are the current treatments for chronic hepatitis B, uh, what's good about them, and what's limiting our cure of hepatitis B. What are the disadvantages, and why haven't we been able to cure more of our patients with chronic hepatitis B? And then at the end, I'll talk about really what's coming in the future, maybe the not too distant future, for the treatment landscape of chronic hepatitis B. So here we are with current treatment. And so we know that there are a number of treatments now available for chronic hepatitis B. I think I'll have a slide in a moment to show you what they currently are. Maybe I'll start here. I've gone a little bit out of order. And so this is a slide I borrowed from Professor Locke, who was recently in town, our visiting professor. And this is a slide that really summarizes kind of the timeline of approved treatments for chronic hepatitis B. Many of you, maybe in the room and online, may remember older treatments like interferon, which were given by injection, available since the 90s. And then there was an advance in the early 2000s when we could give the medication through injection, but just once a week. It had a lot of side effects, and that's the medication that we were very happy to replace with some of the newer oral treatments that came along in the late 90s and early 2000s. The first one being lamivudine, which some of you may still be on. It's an older drug, and it has some disadvantages, but it is has a long proven safety record. But nowadays, I think most patients and most guidelines will recommend some of the newer treatments that are bolded there. Entecavir, tenofovir DF, and tenofovir alafenamide, or Vemlidy. And so these are the really the current treatments, and I would say like 99% of our patients are on one of those three medications if it's been decided that they need treatment for chronic hepatitis B. And interferon really has fallen somewhat by the wayside, but it may make a little bit of a comeback in the future as we still need, as you'll see in a few slides, the the advantage or the contribution of the patient's immune system, and interferon and other immune boosting drugs are very good at helping the patient's immunity to recover or really control hepatitis B long term, often with the help of some of these oral drugs like those shown in the bold on this slide. So what are the advantages of our current treatment? As you all know, hepatitis B has gone really from a very poorly treatable or untreatable disease to something to a condition that's highly treatable in 2025. And all of our medications, fortunately, are very easy to take. They're all oral and they're very convenient, really just once a day therapy. And as many of you will know, there are very few side effects. And so that's why we're, again, very lucky for treatment of hepatitis B that we have easy to take medications with very few side effects. Now, again, there are always exceptions, but for the vast majority of patients, side effects are distinctly uncommon. However, the duration of the therapy is somewhat long. I put that under advantage here, but you could also consider that potentially a disadvantage of treatment. But the cost of the medication is relatively inexpensive, but that's really for 1 year. But as the years add up, then I think many of our patients will tell us that the cost can be prohibitive in many cases. And so that's why we need ways to have better access to therapies that are safe and cost effective for many years if needed. But we know that patients who are on treatment, who have what we call suppressed DNA, may be potentially eligible for a newer therapy that could in fact, cure the chronic hepatitis B. So we don't really talk too much about a cure for hepatitis B right now. It's a goal that we have, but many patients have chronic control and are doing quite well. But can we do better and come up with a cure for them? And hopefully that's coming. So the disadvantages, as you can already guess, are really some of the things that I've mentioned before. Even though the medications are quite safe, the duration is often measured in years and often many, many years of treatment. And I think some of my patients are now on to over 10 or 12 or even close to 15 years of therapy. And they're doing quite well, but they do occasionally ask when can they come off treatment, if ever. The cost over many years, as I mentioned, it does pile up and it does add up over the years. And even though we talk about it being a control, it does not often get rid of the virus or eradicate, totally get rid of the virus in many patients. And that's why a cure is somewhat rare for patients with chronic hepatitis B. And despite controlling infection and making the liver have less scarring in it, there still is a small risk of liver cancer. And that's why many of our patients continue to require screening with frequent ultrasounds and blood work to detect liver cancer at an early treatable stage. So here are this is kind of the treatment landscape we have for chronic hepatitis B now. And I've compared it by their route, by their side effects, the cost of medications, any particular side effects, and the duration. So interferon, pegylated interferon, we still mention in the guidelines because they are an option for some patients, but it's given by injection. It's associated with many side effects, but many of our patients can work around the side effects with proper pretreatment and counseling and knowing what to expect. There are patients who or are able to take interferon for 1 year, and that's its duration. But it is an expensive medication, and there are often difficulties trying to access interferon through insurance, private insurance, particularly, and public insurance, really. Now, all of the other medications in green here are the oral medications that I mentioned before. They're taken once a day by mouth, very easy to take and very, very convenient. And the cost can vary a little bit, but all of these medications will, I think, soon be available in generic form. Tenofovir and Tecovir already are genericized, and their cost is much lower, but still substantial for patients who need to take it for many years. Side effects are very few, and duration is quite long. And so, how good are these medications? This is a slide that I borrowed from Professor Locke again, and this is a nice summary to show us how good are these treatments after just 1 year of treatment, and how can we tell if a medication is working? We look at how much virus is available, is detected in the patient's serum, the blood test before treatment, and then we look again at several months, and then at 1 year In this particular slide, it shows how effective it was in reducing the amount of viral genetic material after 1 year. And you can see all of the oral drugs are pretty good initially at dropping the medications, dropping, sorry, the viral load by a huge amount. And so we often measure this in log values just because the numbers are so big at the beginning. And so when you see a bar like this purple bar drop this much, or this red and yellow bar drop this much, it means the viral amount has gone down by 1 million to 10 million times. And so that's the magnitude of virus that we're dealing with sometimes in patients before they start treatment. And after 1 year, the medications do such a good job at reducing the amount of viral material in the blood that it can often make the patients have undetectable DNA after 1 year of treatment, sometimes after a little more than that, a year or two. But many of you in the audience may have been on treatment for over 5 or 10 years now. And what we expect to see is really no viral material, no genetic material, no DNA after 1 year or more of treatment. So you can see there, because they're quite potent, all of the oral medications compared to interferon. But again, interferon is not as strong an antiviral medication, but it does help to boost the patient's immunity. Now, none of these medications were studied in head-to-head trials, so we always have to be a little cautious when we take data from across different trials and put it together. But I think it's helpful to see it in comparison in a slide like this. And so beyond suppressing and clearing the patient's bloodstream of DNA, viral genetic material, what are some of the other advantages of long-term treatment? And this is a slide from a very important study published over 10 years ago, looking at patients who were treated with antiviral therapy tenofovir for several years, at least 5 years of treatment continuously. And all of these colorful bars tell us about the amount of scarring the patient had in their liver. This is before they started treatment. This is 1 year, and this is 5 years. These bars, again, are patients that are still were still receiving treatment at the time that they did the liver biopsy. And we don't always do liver biopsies nowadays, but in this classic study, they biopsied patients before they started treatment, at 1 year, and then at 5 years. And what these different colored bars really tell us is, if you see more of the red and the pink here, it means these patients had very advanced amounts of scarring. So we're pretty much called as cirrhotic. They had cirrhosis on their ultrasound, on their biopsy before they started treatment. And the blue and the yellow are kind of, and the green are kind of the patients with lesser degrees of scarring in their liver. And as you can see, just with the colors that change over time here, it shows that the amount of blue and green generally increase over the years of treatment. And on the other hand, the red and the pink start to shrink as you go from year 1 to year 5 compared to baseline. And that tells us when the pathologist looked at these slides, they found that those who had cirrhosis at baseline were no longer considered to have cirrhosis at year 5, just because their biopsies had improved so much. They couldn't see any footprints of cirrhosis in approximately 3/4 of the patients who had the red and the pink at the baseline. And so that's quite amazing. It was really something that nobody expected at the beginning of the study, when we were just looking at things like blood tests, the patient's ALT, the DNA, those all got better. But it was very, very reassuring and surprising to see that the liver started to remodel and started to get better. It began to reverse, in many cases, the fibrosis and the cirrhosis that was there at baseline, showing once again that if you can control whatever is causing inflammation in the liver, it does have a remarkable way of healing itself, of reversing the cirrhosis. And so that was, again, a very amazing finding of the study, and another advantage that I wanted to show you of long-term treatment in patients who need treatment. And in another study, we also looked at how about other outcomes of therapy? What else can we do to improve the long-term outlook of patients with chronic hepatitis B with treatment? And so we know that liver cancer is still a major complication, unfortunately. And so with treatment, can we reduce the rate of liver cancer? And so this is one important study that showed us that I think we are moving very much so in that way and improving the prognosis for many patients. The red line is what shows depicts the number of patients who would be predicted to have liver cancer with active liver disease over a 5 to 8 year period. I remember in a study like this, all patients receive treatment. This red line is really by modeling because we obviously do not run studies where if, patients need treatment and do not receive it. They have to receive a standard of care treatment. And so that's why this red line is a model. The little gray dots here tell us the reported number of cases of liver cancer in that clinical study over the 8 year period. And you can see there's a clear difference between the red and the gray dotted line here, showing once again a much lower rate of liver cancer in patients who receive treatment, whether or not they had cirrhosis at baseline. So I think the long-term outcomes have improved. We can reduce the amount of scarring in the patient, and we can reduce infection rates. We can reduce infectivity. So these are again, the huge advantages of being on treatment for those who require it. But when we talk about cure of hepatitis B, this is a harder goal to reach because by cure we mean can we get rid of this protein called the surface antigen, and that's the hallmark of infection. And again, in this cross-study comparison, patients who are on the oral medications, even after many years of treatment, 7 to 10 years, we only saw under 10%, maybe even under 6 or 7% of patients who achieved cure after long-term therapy. And so it goes to show that I think we still have a lot of work to do to raise these bars and increase the success of treatment. But have we reached the limits with just our oral therapies, and do we need something stronger to get us there? Interferon, I won't talk too much about again, but after 1 year of treatment, this is still the medication that's associated with the highest rate of surface antigen loss after 1 year of treatment, approximately 10%. But again, the cost is high and it has a lot of side effects. So again, we then talk about cure, and then moving towards my last slides here. Many of our expert colleagues tell us the way to cure hepatitis B is not only by inhibiting viral replication, and that's really what I think we're doing with our current treatments. We're very good with this left-sided pillar here. And we have newer agents that will maybe enhance the amount or further reduce the inhibition of viral replication. But are we able to also reduce the amount of protein the virus makes and lower what we call the viral antigen burden? I think we have newer and newer medications that are very promising in this area. And at the same time, we have to find a way to boost the patient's immune system. Remember, we talked about interferon, and that's an immune boosting medication, but now we have several other medications and vaccines that are being studied to help raise the patient's immunity. And I won't spend too much time on this very complicated slide, but it tells us that there are other targets, other proteins, and other steps in the virus life cycle that we can target and can study to help come up with newer medications to enhance or further increase the rate of curing hepatitis B. And one of these that I'll just spend one slide on is to show you is something called siRNA, which is a fancy way to really interfere with production of the virus's protein, namely the surface antigen. So if we want to get rid of surface antigen, we have to find a way to interfere with the production of the surface antigen. And so a lot of this is biology and science here, but suffice it, I think the simplified version is if you use a medication that interrupts the step, then you will have lower levels of the surface antigen protein, and that will, in fact, help lead you to a higher rate of cure. And in this particular study, about 9 or about 10% of patients who went on treatment for 24 weeks, just 6 months, were cured of their hepatitis B. But again, it's an early phase study. It was a relatively small study, and some of these patients in follow-up did have a bit of a relapse, and so further study is needed. So I think I'm probably going to stop at that point here, and hopefully you've had a flavor of really what's currently available at our disposal for treatment of chronic hepatitis B, and what's coming in the future. It's an exciting time because I think we will see more and more of our patients who've been on long-term treatment go on to a cure and a better outcome of chronic hepatitis B infection. So. Thank you very much for your attention, and I'm happy to answer any questions. Are we taking questions now, Hin Hin?
We have Stephen slightly late, but I think we can take one or two questions. Thank you so much, Scott. It was a really great talk, a great overview of the Hep B treatment. I saw a question in the chat about kind of two-part. Is all Hep B carrier indicated for treatment? Basically, kind of asking about the indication for treatment. I know it's a really loaded.
Yes. I
Is
only
that
had 20 minutes, so I didn't want to go through all the indications for treatment because it becomes a little bit technical. But as you know, we do have new Canadian guidelines on hepatitis B, and they do encourage really all of our listeners and persons living with hepatitis B really to frequently follow up with your healthcare provider, whether it's hepatologist, your family doctor, infectious disease physician, because the treatment indications have changed slightly, and the guidelines have evolved a little bit, and there are more patients who, in fact, may be eligible for treatment now based on more studies. You know, the guidelines are updated every 5 or 6 years, and new data becomes available. The treatments really haven't changed too much, but we know there are some patients who would probably benefit from treatment where we may have suggested monitoring in the past, but it becomes very individualized, and we always like to have more recent blood work to help decide. Things like family histories may change over time that we may not have realized. So I think it's very important. The key message is really regular follow-up and regular screening for complications, and to see if may qualify for treatment.
Mhm. Scott, for follow-up questions, they said, what is the first-line antiviral treatment now in Ontario?
Yeah, no, it's a great question. That's one of the things that hasn't changed too much. And so tenofovir DF, tenofovir AF, or entecavir are all considered first-line therapies. Each has slightly subtle differences. And again, this depends on what's the right medication for you. That's really based really on your blood work, your own personal history of various conditions like kidney disease, like osteoporosis, and other metabolic bone disease. So in general, it'll be one of those three medications. And after a discussion with your healthcare provider, really that's the best advice is decide which one is the right one for you, if it's decided that now's the right time to treat you.
Yeah, thank you.